The heart is this really big organ. Well, it's not big, but it's a really important organ. Sorry, I should say. It's a really important organ. It's found right in the center of your body, essentially, right behind your sternum. It tips to the left, though. So this is the size. This is about 4 times bigger than your heart. Your heart's about the size of your fist, unless you're sick and you have a heart disorder or disease and it's inflamed. But usually it's about the size of your fist. It's right in the dead center of your body, but it tilts to the left like that. Okay, so it's behind your sternum, but it tilts to the left. And you may remember when we talked about your lungs they got 3 lobes on the right and then 2 lobes on the left to make room for the heart that tips to the left. This bad boy here has a really important job of pushing blood to your lungs and simultaneously pushing blood to your body as well. Okay, so it's actually got a dual pump role. So it pumps blood to 2 different places simultaneously. The myocardium is the muscular part, right? So the big muscle part. If you've ever had it, it's common food in certain parts of Asia. Chinese people love to eat heart, beef heart or chicken heart. Sure, they'll eat any other heart too, but it's a bit more of a delicacy for North Americans. But you'll find that if you buy one, often it has all this weird blood vessels and connective tissue and stuff on the top. And we usually cut that away because it's not really edible. It's kind of hard to chew. It's all rubbery. So when you cut it off, you cut this part off. It actually takes this little, it looks like that. It looks like a cartoon heart because the apex of the heart makes the bottom. And then this top part, actually, when you clean it up, it gets these 2 bulges there, and it turns into a cartoon heart. And that's probably where we get the Valentine's Day heart from, is when we cut all this stuff off that we think is fat and stuff, but it's actually part of the heart. The heart is, pardon me, if we ever had the opportunity to go for an open heart surgery, or maybe you guys in the future will be surgeons, you'll pop open the chest and you'll look for the heart and you're like, well, where is it? It's because it actually lives in a bag of tissue. You got something called the pericardial sac, and it's a sac which actually holds the heart. And you have to open up the brown bag. It kind of looks like a brown bag. You have to open that sac up to see the heart beating on the inside. It's really neat. On the inside, it's got the endocardium. So that's the connective tissue and all that stuff on the inside of the heart. Okay, so inside of here. And then wrapped around it is a sac called the pericardial sac. And that sac lives right behind your sternum, tips to the left. Okay. Now the heart has 4 chambers, or 4 rooms. The first 2 rooms actually don't even look like rooms. When we do our heart dissection, it often looks like just 2 flabs of fat. But there's a flabby fat room right here, and a flabby flat room right here. And they're really flat. Unless it's working and filling it with blood, they sit flat and they don't even look like chambers. But they actually have the name most like a chamber. They're called atria, or atrium, which means room. So you got a room here and you got a room here, and they're just flabby rooms. And then you got 2 other rooms, one down here and one down here. And we call these your ventricles. Okay? And you can see that these are all flabby, and these are kind of like water balloons, and they just fill up with blood. Whereas these ones actually have a job of pushing blood. So that's why they're muscular, like this. They're made of that true myocardium, true muscle, heart muscle, and it beats. This one, I don't know if you can see that. We see another picture, is not as thick. It's fairly thin here. And then this one's got the really thick muscle layer here. And that's because this one just has to pump blood to its neighboring lungs, while this one has to pump blood to the tip of your head, all your organs to your toes. So this one actually has a really big muscle layer because it has to push the blood the furthest. Right? Now, if you exercise, your heart muscles can get thicker. And that's why as you become fitter, it actually beats less. Because it's so strong that when it does this, the blood circulates much better. If your heart is weak, it has to do this a whole bunch of times just to keep the blood moving. While if you're big and strong, your heart just goes bump, and then it's gone around. So your heart rate could fall down to your heart rate could be in the 30s or 40s, while regular resting heart rate's around 60 or so. Then you got this wall down the middle. It's called the septum, and that separates the right and left side. You want that because on the one side, this side is deoxygenated blood, and this side is oxygenated blood. And if the septum wasn't there, then the blood would mix. And then your blood saturation, oxygen saturation levels would be low, right? 70, 60%. And you remember, your blood's oxygen saturation needs to be around 100%, 90-something percent, or you know, below that means you're sick. And if you get to the 80s or 70s, you're going to die, right? Not enough oxygen. Then you got these 4 valves. You got these 4 valves right here, and these valves are actually used to keep blood from going backwards. So when these squeeze, blood goes down. When these squeeze, blood does not go back up to the atrium. They go through another pathway instead. So these are like every time blood comes down, then the door shuts. And then this one squeezes, and the blood can't go back through the same door. It has to go through another door, right? So you have 1, 2 on this side, and then you have 1, 2 on this side too. Okay. Now that septum sometimes doesn't seal up. So we all have holes in our hearts when we're in our mom's belly, because we don't need blood to go to our lungs. So it just goes from our right side and skips the lungs and goes straight to our left side. So you have a hole in your heart. It's called the foraminal valley, oval opening. And that hole, when you come out and you start using your lungs for the very first time, it's supposed to cover up with a flap of tissue. And that flap of tissue usually comes over, covers it, and then it fuses and it becomes a whole wall. It becomes one contiguous wall with no gap at all. Sometimes that flap doesn't fit, or sometimes it doesn't develop at all, and you have a hole in your heart. And as a baby, your blood mixes, and you could be sickly as a child. And if they don't catch it, you will die. When I was in my hometown, I played basketball in high school, and my high school coach had a baby girl that died from it. So she was born up north, and she was not doing so well. She was sickly. And the diagnosis, if they don't know why you're not doing well, right? Like you might be sick and we don't know what's going on. The diagnosis is failure to thrive. You're failing to get big and strong. So she was suffering from failure to thrive. And then they took her to a pediatric cardiologist, and they found that she had a hole in her heart. And by the time they figured that out and scheduled her to fly down here to get to BC Children's and Women's Hospital, she died. So she was just a couple months old. Externally, you have all these blood vessels, and it's because your heart will beat 100,000 times in a day. And so it's doing work the whole time. So one of the first places oxygenated blood and blood with nutrients go is to the heart, to give it nutrients and to give it oxygen. And you have these major coronary arteries, we call them. And if your mom or your dad or your grandpa or your uncle or your auntie, a relative, suffers from heart attack, and that's because one of these gets blocked. And then if it gets blocked, anything downstream doesn't get oxygen, and that tissue starts to die. And your brain can only last about 5 minutes or 7 minutes without oxygen. This can last longer without oxygen because it's muscle, not brain tissue. But if you have enough blood flow disruption, you could suffer a heart attack and die. One of the precursors to it is often called something called pectoral angina. Angina is when you get these starting to narrow. And you could be walking around and your chest feels fine, but when you start exercising, your heart goes like this, and it needs more oxygen, more nutrients, and it can't do it because these are partially blocked, and then your chest starts to hurt, and you have to stop. That's called angina. And the treatment for that is just a little pill that you put underneath your tongue. It's called nitroglycerin, and you put it underneath your tongue, and it dilates your blood vessels. It makes them go from that to that. And then your chest pain goes away. But that's an indicator that you have some blockage. So what they do is if you have a blockage here, often what they'll do is they'll take a vein or an artery from your leg and then take it, cut a hole, and just bypass it. Just skip it. So that's called a bypass surgery. And you could have bypass surgery. You could have double bypass surgery. You could have triple bypass surgery. You could have quadruple bypass surgery. We could skip 4 blocked vessels, right? Those are the 4 major blood vessels, coronary arteries. And if you don't eat right, or you have bad genetics, bad genes, you could have buildup of plaque and stuff in there that narrows them and can cause, a loss of blood flow. Or if they break off, if that little bit of whatever plaque buildup, we call it, breaks off, it can travel to your brain, it can travel to your lungs, or it can block itself down a little bit further downstream and cause a heart attack. Now, yours is a double pump system because you have your right-hand side, and your right-hand side pumps blood to your lungs. Your left-hand side pumps blood to your body. But they don't take turns. They do it at the same time. So blood is going to your lungs and to your body at the same time. They're circulating at the same time. They're not one at a time. But we still call it a double pump. Right? Your right-hand side that takes blood to your lungs, and your left-hand side which takes blood from your lungs and circulates it back to your body. Ready? It travels from the right-hand side to your lungs and then rides back here and then goes down to the left ventricle and to your body, but it does it simultaneously. So these guys squeeze, they fill it with blood, and then they squeeze, blood goes down, and then these guys squeeze, and then blood goes to your lungs and to your body. And then they rest. So we call it systole, squeezing when they beat, and diastole when they both take a break. And that's a fraction of a second. Okay. So take a look at this graphic here. So this is deoxygenated blood from your body. It'll just pool here. And then once it's pooled, it looks like a flabby pocket. When it pools, your heart will beat, and it'll go down here. And then the ventricle will beat or contract, and it'll shove it up into your lungs. And then it'll go to your lungs, get oxygen, and return to this pocket here, your left atrium. And it'll be pushed down. And then it will squeeze, and that will push it through this giant tube called your aorta, which will take blood to the rest of your body, full of oxygen. Okay. And remember, it does this simultaneously. So the top squeeze, the bottom squeeze, that's called systole, and then they both rest, and that's called diastole. So when we take your blood pressure, which we usually do, but for obvious reasons, we're not taking each other's blood pressure this year. It's 2 numbers. Right, 120/80 is if you go to London Drugs and shove your arm in that thing and it inflates, it's looking at how much pressure is in your veins. How much pressure is in your vein every time your heart beats? That's your systole number. That's usually the 120. And then how much pressure is in the vessel when your heart is not beating? And that's usually around 80. Now, as you age, everyone's blood pressure goes up. Everyone. And it's mainly because the vessels are losing their elasticity. They become stiffer and stiffer over time. Plus, adults, they tend to eat not as healthy as youngsters because no one's telling them what to eat. They get to choose. Plus, their taste buds don't work so well, so they put more salt on stuff and things like that. So that increases their blood pressure. And if you go to like 120/80, which is normal, if you go to 130/90, that could be pre-hypertensive. And you go to 140/100, that's a hypertension 1, and then there's hypertension 2 and hypertension 3. So there's 3 different levels of hypertension. Okay, bad because as the pressure goes up, these vessels are only designed to hold a certain amount of pressure. If you get to a certain pressure and your heart's beating, and these vessels are under pressure, one's going to pop. We call it an aneurysm. So you can have an aortic aneurysm up here or down on the descending limb, and they could burst and you're dead. Because remember, 5 to 6 liters pass through here in 1 minute. So if this ruptures and there's no doctor to shove his or her finger in there right away, you're going to bleed to death. You're just going to die of shock, right? You're going to hemorrhage out. Any questions so far? Right on. We want to go just a little bit into the next lesson. So like I said, so we can afford to give you more time during your test. So this is the route. So it goes, blood comes from your body through the vena cava. Where's my big heart again? Here's the heart. Here's another one. This might be clearer. So here's the superior vena cava. Here's the inferior vena cava, and that's blood comes, and it comes actually into this pocket here. Okay, so it comes in here, and it comes to this pocket. And then this pocket, which is called your atrium, your right atrium, contracts, squeezes, and then blood gets pushed down into, so there's your right atrium, it gets pushed down through this valve into this right ventricle. Okay, and we call this valve the tricuspid valve. It's got 3 lips to it, so tricuspid, to the right ventricle. So now the bottom squeezes and blood goes up, and see how it's still blue? Because it hasn't gone to the lungs yet, so it's still blue. And we call that the pulmonary trunk. Okay? Some people call it the pulmonary artery. Why artery? Because it's away from the heart. Blood's moving away from the heart. The valve's name is called the semiluminar valve, or the pulmonary semiluminar valve. Then it'll go to your lungs, right there, and become red with oxygen, and return through the pulmonary veins. And the pulmonary veins are right here on the back. See that? They're red now. And they will arrive here in the left atrium. The left atrium right here. And then the top will squeeze, and it'll pass through a bicuspid valve down into the right atrium. And then the right atrium, or left ventricle, sorry. The left ventricle will squeeze, and blood will pass through the aortic semiluminar valve up into this big red branching vessel called the aorta. And the aorta goes like that and goes down to your body, but it also has these 3 branches that go to your head and arms. Okay? So that's the pathway. Blue meaning no oxygen or low oxygen, red meaning oxygenated. Right? So vena cava, right atrium passing to the tricuspid, to the right ventricle to the pulmonary trunk or pulmonary artery via the pulmonary semiluminar. At the lungs, get some oxygen, pass back to the left atrium by going through the pulmonary vein, passing the bicuspid valve, arriving at the left ventricle, and then squeezing through the aorta to the body through the semiluminar valve. Okay, I know it's complicated, but that's the way it is. And you have to remember, it's happening simultaneously. Right atrium to tricuspid to the pulmonary semiluminar is happening as the left atrium is squeezing to move blood into the left ventricle past the bicuspid. So it's top squeezes, bottom squeezes. So it's happening simultaneously. Okay. The heartbeat. Now, when you listen to your heart, and we do this usually too, we grab a stethoscope and we listen to each other's heart. Maybe I'll pull out the stethoscopes and you can listen to your own heart. But what we're listening to is actually the valve shutting. So every time the valves open and close, it's like a shutting door. And so when we listen to your heart, we're listening to the valve shut. Right? And it makes this lub-dub sound. Right? The atria contracting, and then the ventricles contracting, and the doors to each shutting. Shut, 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 shut. Right? And it makes a lub-dub sound. We can also hear if your heart valves are leaking. Right? If the valves don't close properly, blood can kind of wheeze past it, and cardiologists can listen to your chest and hear that wheezing sound. Again, if your blood mixes, oxygen saturation falls from 100 down to 90, down to 80, anywhere down to 80s and 70s and below, you're going to die. Okay? So if your valves are not working right, you need to have heart surgery. Okay? And these can fail over time because, right, continuously doing this 100,000 times a day. Or they can become infected. So I know people that have had bacterial infections, which has caused the valves to not work, and then they have to have open heart surgery, and they get, sometimes it's pig valves put in them. I don't think they take human donor valves, but they might. Now, when the heart is squeezing, we call that systole. When it's not, it's called diastole, and that is the blood pressure 120/80. Okay, and we'll see if I can pull out the blood pressure cuffs for you too. So like I said, the lub-dub sound is the atrioventricular valves closing. And so that's the one between the atrium and the ventricles. And the dub is the semiluminar valves, and that's the one that sends it to the aorta and sends it to the lungs. And if you hear a heart murmur, that's a whooshing sound. That means, well, you're leaking. We got to fix it. The heart cycle is the top squeeze at the same time, then the bottom squeeze, and that's called systole. And then your heart actually relaxes for a split second, and that's called diastole. Okay, so systole, diastole, systole, diastole. Now your heart will beat if I ask for a volunteer and Sophie puts up her hand, and then I reach into her chest and I rip out her heart. Bad time to volunteer. It would beat. It would still beat because it has its own intrinsic heartbeat. It beats all by itself, and it will beat all by itself around once every 0.85 seconds. Okay, it's got this nervous tissue called nodal tissue, and one lives up here, and then a little bit lives down here, and that just sends an electrical impulse every 0.85 seconds. Now your brain can speed it up and slow it down, but this has its own pacemaker set of cells, and those pacemaker cells just say, okay, squeeze, relax, squeeze, relax, squeeze, relax, and it will beat for a while at 0.85 second intervals. Okay. That's called the intrinsic heartbeat, or control of the heartbeat. And it's controlled by something called the SA node, and that's some nervous tissue, and I'll show you where it lives in the heart, that just fires every 0.85 seconds. 0.85 seconds fire. 0.85 seconds fire. And if your heart, like I said, your brain can speed it up, slow it down. This is, this firing causes the atria to fire, and in a split second it causes the ventricles to fire too, because we have this other tissue called the atrioventricular node. So the sinoatrial node and the atrioventricular node. Atrium ventricle, that's the sinoatrial. We call this your pacemaker. So you may know some family members that have a pacemaker put in. So their heart doesn't beat right, it goes too fast or it goes too slow. Too slow is called bradycardia, and too fast is called tachycardia. And if your heart beats too fast and it flutters like this, or it goes too slow, then we can get metal electrodes put into your heart, and then it runs to a little battery, and it just fires every 0.85 seconds. And it overrides your internal pacemaker. And that will maybe give you a better, more regular rhythm. So I don't know. It's quite common now. It used to be this giant battery pack, but now it's just this little lithium battery that lives just below the skin. They put it underneath your skin, right in your fat there. And it just, a little packet of electricity, and then every 2 to 3 years we have to replace the battery. And that's it. Here's the sinoatrial node right here. So this is the thing that fires every 0.85 seconds. And it sends an impulse to the left and right atria to squeeze. And then that also triggers the atrioventricular node to fire. And that signal travels through something called Purkinje fibers, and that tells the bottom to squeeze. So top squeezes, then the bottom squeezes, and then they both chill out and rest. Then sinoatrial, then atrioventricular, then rest. Atria squeeze, ventricles squeeze, then rest. Okay, and it's got to do with these two nervous tissue nodes. Okay, the sinoatria and the atrioventricular. Okay, and this is just it. So the AV node fires, and it sends the impulse to the ventricles via Purkinje fibers, and it causes the bottom to squeeze. Now, there's also extrinsic control, and that's your brain. And your brain, you guys, if you did your your nervous system lessons, you know about the autonomic nervous system. The autonomic nervous system is different than some of your somatic nervous system because it doesn't have direct input from specific receptor cells. You remember that was part of your lesson? It's kind of just a holistic kind of gathering of information, and it decides if it should speed up or slow down. So your autonomic nervous system, controlled by your medulla oblongata, will detect if your heart rate should go up for a whole bunch of reasons, right? One could be CO2 content, one could be hydrogen ion concentration content, right? Could be other indicators as well. But your sympathetic will kick in to increase your heart rate, and your parasympathetic will kick in to decrease your heart rate, okay, through your autonomic nervous system. So that's the lesson I want to do today about your heart and your blood vessels and how this thing beats. We have a little bit more to do with the blood now, so that will be next day. So we'll talk about blood elements, blood cells, and lymph, and then we will look at immune over the last 2 days. Okay? So I wanted to show you this last little video clip that kind of summarizes everything, and then we'll call it a day. If it will work.
Organ about the size of your fist.
Oh, yeah.
And is located slightly left of center in your chest. Your heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, the right atrium and ventricle, collects and pumps the blood to the lungs through the pulmonary arteries. The lungs refresh the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within your heart keep your blood moving the right way. The tricuspid, mitral, pulmonary, and aortic valves work like gates on a fence. They open only one way and only when pushed on. Each valve opens and closes once per heartbeat, or about once every second. A beating heart contracts and relaxes. Contraction is called systole, and relaxing is called diastole. During systole, your ventricles contract, forcing blood into the vessels going to your lungs and body, much like ketchup being forced out of a squeeze bottle. The right ventricle contracts a little bit before the left ventricle does. Your ventricles then relax during diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts over again. Your heart is nourished by blood too. Blood vessels called coronary arteries extend over the surface of your heart and branch into smaller capillaries. Here you can see just the network of blood vessels that feed your heart with oxygen-rich blood. Your heart also has electrical wiring, which keeps it beating. Electrical impulses begin high in the right atrium and travel through specialized pathways to the ventricles, delivering the signal to pump. The conduction system keeps your heart beating in a coordinated and normal rhythm, which in turn keeps blood circulating. The continuous exchange of oxygen-rich blood with oxygen-poor blood is what keeps you alive.